And we're live again. Hello, everyone. It's your host, John Lynn from Sunrise Urology. Hey, if you guys ever, thought, as a child, I've always wanted to be like a police officer or a firefighter. But if you want to know who actually takes care of firefighters and police officers, I've got your answer right here. Let me introduce you guys to Megan McCarthy from Heartfit for Duty. We have known each other for many, many years. Actually,
we have, I know.
Before you started Heartfit for Duty.
A long time.
I think cardiovascular, heart.
Yeah, Heart Sciences Center with Dr. Nabil Deeb.
That's right.
First cardiologist that I worked with out of school. And then worked with some other cardiologists along the way. And yeah.
And here you are. So I'm super excited to learn more about what Heartfit for Duty is all about. I know you guys started many years ago. So what do you guys do?
Well, we started about 7 years ago, and the biggest issue that happened was kind of a tragic story that has a really happy ending, in that we had, 7 years ago, we had 3 firefighters that died suddenly. And they were in our community. They were in Queen Creek and Chandler and in Gilbert, and they were all in their 40s and 50s. And
Wow.
It just didn't make any sense why such young guys should die suddenly of a cardiac event, and they get annual physicals every single year. Usually there's a couple places in the valley that do it, but they do a really good physical. We're nationally known in Arizona for having the best medical care for our first responders. So it seemed a little bit weird that this was happening. So on the 4th young man that actually had a heart attack, this is kind of the game changer, is I was working for Dr. Deeb in stem cell research, and I was screening patients with their first big heart attacks. And one of them happened to be a firefighter from Chandler who had a big heart attack. And he was an ex-professional baseball player in optimal health, had just had a wonderful treadmill stress test with 15 Mets, and in cardiology land, that's a really good score, meaning you're really fit. And he had gotten a clean bill of health, and rightfully so, from what the testing we knew was adequate. And he ended up having 2 stents put in, and he survived, obviously, which is great. But, after it's all said and done, it cost the city $160,000 for the 6 months he was out on light duty. So you think about, what's the impact both emotionally, physically, health-wise, economically in the first responder population?
And also for the city, because he couldn't work full duty.
Right, exactly. And so they had to backfill his position because he was an EMT as well. So when we looked at that, I went, hey, there's some testing that I knew about in research. I thought, gosh, if we could just catch it earlier, if we could just figure out a way and understand why do firemen and policemen have heart attacks 10 to 15 years sooner than their general population, we'd be onto something. That was 7 years ago. Okay.
All right. So tell me about, I know you have a lot of titles after your name. What
Way
do
too
they
many.
mean? So NPC, that is nurse practitioner?
Nurse practitioner certified in adult medicine. First in Arizona State University graduate, downtown campus. I'm proud to say I was in the carpool lane a lot those years. And then CVNP is a cardiovascular board certification. So they certify you similar to a non-interventional cardiologist as an advanced practice nurse.
So an interventional cardiologists are the docs who actually put in stents and
they do the fun stuff.
Procedures.
They put stents in, and
I don't know. That's pretty scary to put stents and put wires into the heart and stuff like that. I don't know.
I'll leave that to them.
Well, that's a little scary to me. And so you noticed that was happening, and then what?
So we noticed this was happening, and I thought, well, there's got to be a way to test my theory of what we could order to find this early disease. And so I came up with a testing protocol of labs and a little calcium scoring and some other tests that were kind of just out in the research area. And we got a grant from the American Academy of Nurse Practitioners and one from Dignity Health.
Wow. And
they funded us to test 30 firefighters in 3 different cities and say, okay, let's see if your theory is legit. And it was. It turned out that we caught 3 guys that needed to have bypass surgery.
So based on your protocol that you created, you were able to predict the men or the firefighters who were likely to have a heart attack, and you were able to
And we found early
Prevent it.
disease. Yep, we found early disease before they had the heart attack. And that's what I've learned so much from my cardiology specialists, the wonderful men and women that are out there, is if you can catch them before they have that heart attack, they will live just as long as someone who doesn't have stents or whether they have stents, as long as that heart muscle is preserved.
Kind of like a diabetic who is controlled, they live the same type of life expectancy and quality of life as
Correct.
someone who's
Yep.
not a non-diabetic. Oh, that's incredible. Okay, and you started this 7 years ago. How did you, where did you start, and tell me more about that story?
So we started kind of on the weekends and evenings because we had to work our
So you had a
full-time
daytime
jobs.
job, okay, all right.
And then we would run around in different cities, and we went to lots of different cities in Arizona, and we would test, 50 guys, 100 guys here and there, and just go out there and draw labs and order tests, and then come back and talk to them about their tests. And then some of our results got noticed by a big company in Boston. One based in Framingham, Massachusetts, a very famous city for my
Yes.
geeks who are out there that are cardiology geeks.
Yes.
And where all the neat guidelines come from. And Boston Heart noticed us and said, "Hey, what are you doing? Because your tests in the beginning are horrible, and they're really getting good with what you're doing. So what kind of program are you working on?" And so we went out, we flew to Boston and talked to them about our results, and they funded a $3 million study with Boston Fire and Arizona Fire, and had a head-to-head competition of who could eat the best foods and what kind of factors are we looking for. And so
Who can stay the healthiest?
who can say the healthiest?
Okay.
Yes.
And
And I would
how-
love to say Arizona won. Ha. And not completely. We had some guys in Boston that won some competitions too, but the Boston Heart was very generous in helping us get started. And we presented our data at the American Heart Association in our poster session, which was exciting. We presented another set of data this past year as well. So the funding keeps going, and the change in health keeps happening over and over again.
And have you guys
So-
tweaked the protocol even more? Or?
We have. So as new and exciting tests come out, gene expression testing and different types of use of calcium scoring and advanced lipid testing and inflammation markers, we're changing as the science is changing. We really don't have opinions, if you will. We let science speak for us.
Sure.
And so our
That's the best way to go.
it is. It takes all the pressure off of us, right?
Exactly.
As scientists.
Yeah. Data don't lie, right?
It doesn't. Yeah, the numbers are the numbers. So the neat thing is that we get the honor of taking care of our first responders. And many people think, oh, yeah, those firefighters going into burning buildings, but they forget that this police officer standing on the asphalt is 160 degrees and they're all wearing black, and they're at that same scene but without masks on and without some of the protective equipment. So they're just as high risk as the firefighters are. They're just just under the radar a little bit.
Sure. So speaking of first responders, just so that we know what we're talking about paramedics, EMTs, military, police officers, firefighters, and rescuers. Now that's your target audience.
Yes, and their families.
And their families. Okay, so it's not just the first responders. You take care of their families. A lot of people don't realize the amount of stress that is placed on a firefighter. For instance, I learned doing research for this interview that they put on about 70 pounds of gear whenever they go fight a fire.
Yep.
And I also found that they have a much greater risk of dying from MI than the general population while on duty, and they have a much greater chance of developing cancers,
Yes.
especially the firefighters who respond to a lot of fires.
Yep. Our hazmat firefighters and our wildland firefighters as well, they're out there without any SCBAs on. They basically have their equipment and everything's burning around them, and they're inhaling that every single day.
I think back in the day, when the firefighters put on the SCBS, which explains to the audience what's an SCBS.
It's their mask. It's that
Okay.
cool looking mask they put on when they come in and
Self-contained breathing apparatus.
yes, exactly.
Okay.
Yep.
So in the old days, the firefighters are like, "I'm macho. I don't need the mask," and it's like a badge of honor to go in without a mask. And now I think everyone is mandated to put on the mask.
Well, they're mandated, but the culture's changing too, and we see that a lot with our Boston leaders, the unions out there, and in Arizona. Arizona's, it's a younger crew, and they kind of have always grown up with that health mindset. Whereas our East Coast, they have a lot of traditions. I mean, literally, some of those fire stations, they've got gnaw marks from horses way back when. They're kind of fun to visit, but you can see where they have more asbestos and more stuff they're exposed to.
Sure.
And with these guys, they really have worked so hard in the last few years to remind the guys to wear their equipment and to have washers for their all that soot that we think is so cool for TV. that's what's killing them. So they have to wipe down with wipes. They have to make sure they change out their turnouts. There's lots of science behind that, and even the exhaust from the trucks just pulling out of that garage space.
That's true.
They have now the covers so that they break apart from the apparatus as they're driving away. So
No
they don't.
kidding.
So they're not inhaling some of those chemicals. So there's a lot of great leaders out there that are trying to help decrease it. But as providers, we need to say, okay, how long have you been in the fire service? How many deployments have you had? How many times have you been deployed to wildland? Were you wrestling in alligators for one of the fires in Florida? Were you in Montana?
Yeah.
What's your exposure rate like? And then, do you do hazmat?
That's true.
Where are you inhaling everything? Are you in military where they were doing burn pits? I learned that. I was kind of humbled by one of my people, is I'm from an Army family. My brother's a colonel in the military, and so I understand Army, light infantry, what they do. But I was told by an Air Force veteran that they were doing burn pits in the Middle East and all these different places, which means they're inhaling who knows what. So when I'm looking at them going, gosh, what are they at risk for? Is it lung cancer or thyroid cancer or kidney cancer?
Yeah.
I have to look and add up all those little check boxes and then determine, what am I going to test for? Am I going to send them for a colonoscopy a little bit sooner? Am I going to, dip a urine that day? Am I going to send them for a chest x-ray?
Right.
I need to make those decisions, not just based on the guidelines, because by the time they're 50, that's too late.
There's so much nuance in a patient's background that is not generally picked up by whatever the guidelines, such as put forth by the NFPA, National Fire Protection Agency. They have guidelines on medical examinations.
1582, I know it well.
Yeah, and sometimes you have to go beyond that based on, because not every patient fits the mold of.
And that's a baseline. That's the very basic, looking at those volunteer firefighters, and that's just for fire. Police doesn't really have that. They have OSHA, they have SWAT, SWAT cops, they have to go in with full masks and everything. But you think about the explosives and things that they're exposed to, that's no different. So they both need screening. And then on the top of that is the cardiac part of it, is trying to make sure they're fit, they're exercising, and they're eating really well. I mean, I did a ride along with an officer at night, and the only thing open was QT and Filibertos.
That's true.
And that was it.
and you have sent quite a few patients over, and I have seen a lot of these police officers, and unfortunately they are just like the general population. They're overweight because of the shift that they work and the availability
They don't
of the
sleep.
food.
Yeah, they don't sleep. It's high stress.
Irregular schedules and stuff like that.
I know, but they love you. So I hear that all the time. So
you're too kind. So as part of that NFPA physical examination, you're not just focused on the heart or the cardiovascular. It's everything. It's
everything.
Neurological,
Yep.
muscular, skeletal.
It is.
Psychiatry even.
Yep, shoulders and backs and knees. And I always joke that if they would just stretch their hamstrings, they could really save a lot of back injuries. But it's hard because they're lifting and they're exercising, doing all these things, and they're like regular athletes trying to stretch a little bit more. And then also, looking at medications where they're taking. We do depression, anxiety screening. We do post-traumatic stress treatment. We look at everything from hormones. I mean, you don't sleep and your cortisol levels go up and you put on a little bit of weight and just watch your hormones drop. It's really sad to see that. And then you feel like garbage. I mean, that's the hard part. It's like this thing that happens over and over again. But if you can just get ahead of it and fix the sleep and fix the little bit of extra weight and get them eating better and packing their lunch and at least finding the good things at QT, not the roller dogs.
Take it.
But when you check out, you have the roller dogs on one side
they're
and the
just spinning
donuts
right
on
there
the
and they're
other.
glistening.
It's terrible.
So good. So very good. Hey, for those of you guys watching live, please feel free to ask any questions in the comments, or if you're watching on the replay, please feel free to ask any questions about first responder, care for the first responder, or any questions about what Megan does at her practice, Heartfit for Duty. So I saw a patient who came in for vasectomy. It seems like I have now done whole firehouses, the vasectomies for all of them, because
That's because you give away T-shirts. That's what they want.
They keep talking among themselves, and then they keep coming in here. And I had a guy who came in yesterday, and he said he saw Terrain, one of your providers at Heartfit for Duty, and he said he's seen a lot of providers in the past, and Terrain and your staff and your team were the only ones who not just say, okay, your lab's abnormal, but explain why it's abnormal, and on top of that, what you can do about it.
Yes.
So you don't just say, okay, it's abnormal, take a pill. You address the entire patient.
And we spend about 20 to 30 minutes with every patient, which seems like practice suicide, right? When you think about the models that typically are out there, you're seeing every 7 minutes, so you have to have another patient in front of you. We don't do it that way. We're comfortable with that, and the reason is that so many people, they need to know what to do. Okay, so what? You're pre-diabetic. What does that mean?
Exactly.
Well, what's a carbohydrate? That's where we start. So we have nutrition resources. Our providers all have a link somewhere. Our staff does. I mean, many of our staff are either their spouses are in fire or police. They used to be, like Terrain used to be a wildland firefighter.
Oh, I didn't know that.
Yeah, so that's previous in his career. Mike, another provider who works for us, used to work with one of our agencies for 15 years. You know, so there's a lot of people that are linked to either military, police, or fire in the family. So they get what the lifestyle's like, and then they go, okay, how can we do things different? So as providers, we live what we teach. So we eat really healthy food. We don't let the representatives bring bad food to us. So if you're going to bring something to the fire station or police station, please bring something healthy.
That's great.
Heartfit, yeah, not donuts, but
that's good advice.
But it's trying to find diet and exercise and start with that, and then there might be some supplements to support them along the way, and then use medication if you have to. You know, it's kind of the last resort for us.
Speaking of supplements and monitoring things, on your website, Heartfit for Duty website, you guys actually have stuff that you recommend.
We do. We have some things on there, and not everything. It's not a complete inclusive list, because we try and take what people like, you know. So I'll tell them, okay, so for us over 40 people, sometimes we need more scavengers to help our muscles not ache when we're working out and trying to get in better shape. And some of the supplements, you know, there's prepackaged things, like if someone's selling isogenics, okay, great. We'll use your isogenics and piece out what pieces are missing from that. Or if you're doing Advocare or you're doing whatever it is, we'll say, okay, this is what you need. We don't care where you get it from. We're not trying to push one business over another.
Sure.
But here is the secret sauce of what doses matter, what kind of fish oil is the best, and what kind of vitamin D do I need, which is important so that nobody gets sick when school starts again after spring break.
Yes, exactly.
Right, because everybody's going to get that same cold. So the idea is to try and give your body the right tools so that it fights off disease, it fights off cancers. Vitamin D is a big one.
So you don't care where these first responders get their meds. You just want to provide at least a revenue, a source.
Yes.
Of where they can get that.
And we just link to Amazon. That's the easy part. So it's really I know it looks cool on the website, but it's really a link to Amazon to say, okay, here, where do I find that 10,000 or 50,000 international units vitamin D?
Oh,
just click the button.
So
there it is.
It's not even a store at your website. You are linking out to Amazon, and first responder patients can just buy from Amazon. You're not even capitalizing on
I
that.
tell you that our
amazing.
first responder population is very ethically and morally driven. They will not tolerate, and neither do we. We don't want anybody thinking, oh, they're making an extra buck off of us. We don't want any proprietary issues like that. So
cool.
We don't have anything. We're not selling supplements in the office. We're not, injecting Botox on the way out. We're not doing anything like that. Not that they haven't asked, but
Oh my gosh. Some of the patients have asked some interesting things in my office, that's for sure. So let's go over your team members at Heartfit for Duty. So first of all, you have Josh Zeidler, who is our
medical director.
Your medical director. And then you have nurse practitioners. You're one of them. And then Terrain Faust.
Terrain Faust, and we have Mike Barrows. I say Michael, I just made him in trouble.
Yeah.
And then we hired a new one, Brooke Allen, who's her husband was in fire, now he's going to police. We always joke it's the wrong direction, but it's not the wrong direction for him. And so she's new to our fire and police family. So we have 4 total nurse practitioners that are seeing patients. And then we have some amazing medical assistants who never get mentioned, right?
That's right.
So we have Amanda and Jacqueline, who are 2 full-time right now. We have some part-time folks that help us out. We have a firefighter and a police officer who help us, on when we are busy on days that we need more help.
No kidding.
Greg and Will. And then our front desk are just rock stars as well. Mel and Tracy, they're the first faces you see. We've real humans that actually answer the phone. It's not pressed 5 different keys.
So you don't have a phone tree when people call you?
In fact, our text messages, we do text messages to remind you of your appointment. it's a real person. So
Texting,
sometimes
really?
there's like a witty banter that goes back and forth, like, "Oh, really? You want me to show up?" And then they'll text something smart back, and
That's great.
it's
Wow.
one of the satisfiers for our
So
patients. They love it.
you're using new tech in an old-fashioned type way and putting a human spin to that.
Absolutely. Yep.
How odd that you have an actual person answering the phone when people call you. That
Old
is just
school.
unheard of.
I know.
When it comes to in the medical field. That is for sure.
We travel too, and that's the other thing that's kind of unique about us.
I was going to ask you about that. So I know that you guys go to Boston. Oh wait, that's before we move on.
Yeah.
Kepra. She's another team member.
Yes.
Let's not forget her.
Another owner.
Okay.
Yep.
Another co-founder like you.
Absolutely.
Okay. Very
We
good.
met at the chart way back when at that Firefighters heart attack.
Oh, no kidding.
Yep, that's kind of how we really started. So she's married to a firefighter, and spent a lot of time in public safety, and she's kind of our PR and our sales people that are outreach. So if you probably have seen lectures by her or whatever, that's your first contact typically. And then, basically it's in my view, it's easy sales because we have such a great team that
Yeah,
you come
no
into
kidding.
that,
A great purpose, a great
we
mission.
keep her promises.
Yeah, no kidding. So I see your face all over the place on social media, and you guys are also on
And
Facebook.
billing department too. I have to mention we have a great human as well in billing, so it's not just all automated too. So we try and have that human touch everywhere.
So you have billing in-house.
Yes.
Okay.
Yep. We have a hybrid, both we have external for the simple, easy claims, and then for the more complicated things, we have a wonderful biller named Lynn who's fantastic. So.
Yeah, running a practice myself, I can definitely relate to having a wonderful biller. And shout out to my wonderful biller, Olympia.
Yes.
So besides the heart, genetics, lipids, you guys do also hearing tests. And because I remember you guys moved your practice from somewhere, and then you had to move somewhere else, and then that hearing testing booth.
The giant hearing testing booth.
So
yes.
tell me more about this hearing thing. Why do you? I guess that's part of the NFPA test, right?
It is, but
Okay.
a lot of firefighters and police officers, they're firing guns, which you're familiar with when you shoot rounds. You have to wear good hearing protection, and you can lose your hearing over the years. So we check that every year, and we look from year to year, make sure there's not more than a 10% reduction in hearing, and then we do vision as well, peripheral vision and color testing and all that kind of stuff. We check for immunizations, and then we do cardiopulmonary stress testing, which is then
Actually, put them on a treadmill and
a
do
bike.
A
Yes.
bike, okay.
So the exercise should match the effort. So you figure that firefighter with 70 pounds on him is going upstairs typically.
Correct.
With his tools. Now, is a treadmill really going to help?
No, probably
Not great.
Yeah,
So
lower
a
speed,
cycle
higher.
is better because you're really using those big muscles. And anybody who's got heart failure experience, we know they can walk all day long. Make them walk upstairs.
That's true.
And then all of a sudden it gets real.
Yeah, and same
So-
as I asked about that too before I prescribe like Viagra, Levitra, Cialis. A few of the questions I asked are they on nitroglycerin?
Yep.
Have they had heart disease? And do they have any trouble walking up a flight of stairs? So actually,
Exactly.
that's one of the questions I asked.
It is one of them.
Okay,
And
I'm doing the right thing then.
the neat thing about the cardiopulmonary stress testing is that it's the American College of Cardiology Care of the Athlete standard. And that's a society I'm just newly a part of because it sprung up the last 3.5 years. So all the NFL, NBA, soccer, all the worldwide silos of cardiology knowledge were not sharing information until a few years ago. And now they are, which is pretty neat.
So now you are part of that society, and now you're adopting
And
their
they invited
standards.
firefighters in this past year for the first time
kidding.
because they realize that they are much more like athletes. They're acting more like athletes. That's why the traditional treadmill stress test is missing it, because they are building collaterals because they're so active and they're so busy and they're carrying all this gear. They're not like your typical cardiology patient who has that nice slow growing, easy to track,
Right.
At least
Heart-
logical
heart
anyway.
narrow- and vessel narrowing.
There's nothing logical about a 35-year-old firefighter having a heart attack. There's
Yeah.
nothing. It's like,
Yeah.
what happened?
It's amazing that when I was doing the research, the percentage, the higher percentage, significantly higher percentage of firefighters who die on duty from heart disease relative to the general population. That's just amazing.
But it's also how you do the test. We also push people to 100%, which is unusual. You put treadmill testing, that would have been no. You do 85%.
Sure.
220 minus your age, and that's the calculation. That's not effective in a firefighter because they don't quit at 85%. They don't say, well, I'm going to put my pack down and sit down for a while. No.
Yeah.
They got to get in there. And
Right.
that's the difference is you have to push them to at least 100%, and then really look at the small vessels and the big vessels.
Right.
So traditionally, you're looking for big vessel blockages, and that has worked great, and it continues to work great in many models. But for our first responders, you want to check the small vessels first and make sure if there's a traffic jam. I mean, I know when I'm going through Phoenix,
Yeah.
if it's yellow or red, I'm going to take a different route.
That's right.
And
That's right.
the heart does the same thing. Like, we're going to build our own little road here when I'm hiking up that mountain and doing my fitness testing.
So how do we get more of these first? So when I see a first responder, I always ask him, "Are you going to see Megan or Josh or Terrain or Mike?" And often they say no, they're not seeing you guys. So how do people get connected to Heartfit for Duty?
Well, the easiest thing is the website. Again, it's that new technology and old technology. It's
Sure.
to real people. So if you go on to the Heartfit for Duty website and say get tested, you can fill out a little information about yourself, your contact information, then a real human, Tracy or Mel, will call you and set up an appointment for you and go through a little bit of, okay, what are you looking for? Are you just want to make sure you're healthy? Do you want to lose weight? Are you worried about cancer in your family? You know, what is it that's kind of that question you have, that burning question?
Sure.
And then that's where we focus and go from there. So
What about getting greater adoption from, let's say, big agencies or cities maybe, or whole departments?
we have, and that's what's been fun about it, is it's all word of mouth. And we literally have gone from 6-7 years ago, one or two agencies that we were doing annual physicals for and seeing as patients to we're seeing a lot across the city. We had 3 new contracts just this week
Wow.
in different parts of the state. And
That's
we've seen
amazing.
over 22 cities in Massachusetts where we've flown out and screened them. We have a staff out there as well. So we kind of are now on both coasts.
Yeah,
A little bit,
Boston
yeah.
and then now in Phoenix. So I have a couple of comments. James Ramsey said, is Heartfit adjunctive or replacement for PCP family provider?
It's both.
Okay.
So we do annual physicals, which is an occupational health part of it, but we also do primary care. And that's where Train does most of our primary care. In Brook now, we'll be seeing regular patients. So they do everything from, well, women's annual exams. They'll do blood pressure checks and anything that the PCP would do, burning moles off, whatever.
That's great to know.
They can do all those things.
Wow,
Yep.
that's amazing. And James, let's see, as an ED provider, curious if there are different workup standards for first responders than lay person. I assume that he is talking about acute MI or chest pain, or
Not for STEMIs.
I think the workup is the same, right?
They do a great job already. We don't
Yeah.
need to change that. The difference is that if they're not having a heart attack, but they're having really that subtle type that's more found in a cardiology office or in a regular primary care office, is that they can't do the workouts they used to do. All of a sudden now they're getting winded when they're halfway through their workout where they never did before. We're looking for the subtle things. But as far as ER, it's not going to change that part of it at all.
Okay, so the
They're
workup.
doing a great job.
So the workup for the acute MI or suspected acute MI remains the same. Tyler Clough says, it's been too long since I have seen Megan. Unfortunately, his insurance changed, and he says that you guys do a great job at Heartfit for Duty.
Well, thank you. And insurance is always a challenge because sometimes we take plans, sometimes we don't. We don't take Medicare and we don't take Access. We only do commercial insurance, but we do have a very aggressive cash pay program.
Sure.
So if you're like, okay, my deductible is $10,000, I've got this other plan, I don't want to switch, but I want to see them for a visit or two, we can quote you the inexpensive cash prices and come in, get seen for a couple of visits, and then go back to your PCP. So we can do it either way. We just want people to be taken care of.
Yeah, a lot of patients have, a lot of our patients have decided that their deductible is too high. They decided to just pay for cash out of pocket and just get the care because it ends up costing them less.
It does. It does. It's just if we can control those lab costs, that's always the challenge. But
So, yeah, well, I guess you heard the interview that I did with Dr. Darrell Lamb.
Yeah.
His company is going directly to the labs and negotiating with them directly, but that's a different model.
And we've been doing that too, and we got our calcium scoring down to $55, which is a steal, which is wonderful. But that's because I think it's more of the local businesses that are really dedicated to helping first responders. It really wasn't about our wonderful techniques in negotiating. I think it had more to do with like, yeah, we like police and fire. We'd like them to come by if we ever start on fire or need someone to help keep us safe.
True. What are some of the things that are unique to? We talked a lot about firefighters. What are some of the things that are unique to police officers that you've seen?
I think the stress. I mean, because firefighters, they will work what they call 4896 or a modified Kelly. They have these different work schedules, and depending on their station, they may work 24 shifts for 2 days in a row, but they'll have 3 days off. My police officers don't. They work 4 days in a row, and then they're working overtime or they're working extra shifts.
Another job.
Yeah, so they're always doing second jobs, and so they don't get a chance to relax. They don't get a chance for that cortisol to come down and to kind of help them sleep better and handle daily stresses. And plus, think about where they're responding to. It's the worst of the worst.
That's true.
You know, it's horrible calls and it's horrible tragedies on the highway. They're the first ones that get there, and that they're human.
Yeah, we often forget that.
You can't unsee that. Similar to a military person who's been deployed 2, 3, 4 times, they're going to be much higher risk for post-traumatic stress.
Yeah.
But there are ways that
sure.
you can feed your brain to be more resilient. More omega-3s and avocados and fish oil and avoiding the roller dogs that are full of trans-saturated fats.
But they're so good. They taste so good.
They're shiny. They're
easy.
too shiny.
I know, and they're just rolling, wanting you to go get it with
and
the bun.
you smell them. I know.
So awesome. What about, do you guys have any, meditation recommendations for the police officers and those who are susceptible to PTSD as well?
That's a really great piece of it. First is getting some sleep and getting REM sleep. So they're dreaming and one of the biggest things I ask them is, have you gone on a vacation and when's the last time you really had a good belly laugh? And if they can't answer that question, I know they're stressed if they're not sleeping. So the big thing is trying to create healthy balances, number one. And then the other thing is turn the TV off. That's one of the first things I tell them. Don't watch the news. You live the news.
That's true.
Don't watch it.
That's true.
You know, what are you going to see? Repeat the same images. And so you have to protect your brain just like you wouldn't walk on a broken leg. You have a cast on it until it heals. Same thing with the brain. Only let good, positive of things in. Surround yourself with good, positive people that are not going to drain your energy. You know,
I love it. I love the holistic approach.
Yes.
For a lot of my patients who come in and say, oh, they're having difficulties in the bedroom, one of the recommendations I tell them is to avoid to get rid of the TV in the bedroom. Not only will they sleep better, they will kind of dissociate from that constant fix of dopamine, and that light from the TV makes your brain think that it's still daylight.
Yep.
And thankfully, the cell phones nowadays have that the nighttime blue light, so that it mimics nighttime, which I think you should still get rid of.
It's a little better, but
not quite as good. So sleep affects job performance and your performance in the bedroom.
Yep, absolutely. And the crazy thing we always teach it is you've only got one bank account. You can either fund the fight or flight response, which makes them very good police officers. They are on it. They think quick. They make great decisions. You know, same thing with firefighting. They know just what to do at the right moment. But if you're funding that bank account, the one that's not getting funded is the feed and breed. Your belly is upset, and the sex organs are like, seriously?
Yeah.
We're being chased by a bear right now. So I'm not gonna get busy with my girl or my guy. So that's really the reality, is that you have to shut that brain down enough to fund the bank account. Yeah. Yes.
Fund the enjoyment,
yes,
relaxation, fun bank account.
And not be taking Tums and omeprazole and all the belly stuff, right?
All the time, that's for sure. I understand that you guys I know you guys started a few years ago at the Mesa office, right?
Yes.
And now there may be another office that you're opening up?
Yes, we have our main Mesa office, and that's off of Southern and Higley. And then we opened up another office inside of a cardiologist's office. Strange, right?
Imagine that.
I know. It's either a baseball field or it's got to be a cardiology office. My two happy places.
Exactly. Golf course.
That's true, but there's no offices there. It turns out.
True.
So
well,
I know it's not fair. But
clubhouse.
We have one at the 7th and Thomas out of one of the cardiologist's office that just opened up. Mondays and Fridays we're seeing patients now there to be more of a central location, because we have a lot of police and fire from the West Valley and Central Valley that didn't want to drive all the way down to Mesa. And then for the physicals, we'll drive to you, which is kind of neat. So we go up to Pitt.
How does that? Wait, okay. So how does
Pine
that?
Top, Timber Mesa.
So you're hauling all this equipment to different outlying local.
It's so
Phoenix.
Glamorous. Yes, I'm so glad you asked. That's a ponytail day in my world.
And believe it or not, that's how she missed our last appointment. We're going to do this episode much sooner,
Oh.
but she was stuck out in Peoria.
I
Yeah.
know, with a U-Haul full of equipment. So,
Wow.
no, it's what you do. But that's okay because the reality is if we go up there, then we can serve people that can't drive down. They don't have the resources up in those rural agencies.
Got it.
And so we can say, okay, we're going to be up here for 2 weeks. And if you've got 8 guys on your fire department and they're volunteer, or you got 100 guys, we'll test them and treat them the same. So that's what we try and do and be as accessible as we can.
How awesome is that?
It's fun.
We have the first responders taking care of us, and then we have you to take care of the first responders so they can stay active, engaged, so they can take care of us. What a
A great team.
Yeah.
You can't do anything without a great team.
I second that. That
Yeah.
is for sure. My office staff makes my job easy. Makes me come to work like it's not work.
Yeah, and they laugh and joke with the patients. Let me tell you, it is so fun. I kind of get jealous sometimes if there's so much laughing going on outside the room. I'm
Exactly.
like, what are they all doing?
I feel the same way.
I know, but they're having a ball.
I
And
feel
that's-
like I want to
yeah.
go out and have fun. But sometimes we have a lot of fun in the exam room, and they're probably wondering,
That's
why
true.
are we belly laughing in the exam
And we
room?
can't say a word because it's HIPAA.
That's right.
It's the cone of silence.
But I try to anonymously share some of the interesting stories that I may or may not have changed to make it interesting on my Facebook timeline. Speaking of Facebook, you guys are also on social media, right?
We are, yes.
So let me share with our audience that you guys are on Facebook, Heartfit for Duty, and are you guys on Twitter as well?
I'm on Twitter, yep.
Okay.
And then we have an Instagram account as well, and we also have Snapchat. So we're trying to be...
I'm going to have to follow you on Snapchat.
I know, it's hard. It's hard. So I haven't done any movies or anything yet, but I mean, it kind of freaks me out that the whole thing disappears, which I'm not sure where it goes. So
It never really disappears because
my officers tell me that nothing ever really goes
no,
away.
nothing ever goes away. Nope, not at all.
And I believe them.
Well, I think we covered a ton of topics.
Thank you. I appreciate it.
Yeah, I was wondering if our audience has any additional questions. Nope, I don't think so. If you guys are watching this on the replay, feel free to leave any questions in the comments, and I'm sure Megan will be more than happy to answer them.
Absolutely.
We're talking about taking care of our first responders and Heartfit for Duty. That is all they do. Actually, first responders and their families.
And their
So not only
families.
do you take care of the first responders,
Yep.
you take care of their
We
families.
even had
as
a
well.
realtor come in because he said, well, the firefighter told me when I sold him his house that I should come see you. I'm like, okay, you're part of the family. So
Wonderful. So I guess anyone associated with
Yes.
first responders.
Yep.
If you can look them up on their website and social media.
Our phone number's on there, our website's on there, and you'll be talking to a human being when you call, which is really kind of fun.
Such a little thing that you can do to make such a difference. Not just answering the phone, but what you all do at Heartfit for Duty. So thank you so much for all you do and your team. Thank you so much for coming.
Well, thank you for the
And-
opportunity.
If you have any questions, ask in the comments or contact Heartfit for Duty. Good night.
Thank you.